For today's lecture, I'm going to demonstrate how I would do the Gua Sha treatment as I outlined in the lecture video for AT362. So I'm going to use my model Cole, and I'm going to use the Gua Sha treatment on the upper, middle, and lower fibers of the trapezius. So I'm actually going to use these tools here. These are called the Gua Sha tools. The first two that I typically like to start out with are the scanners. So these ones are a little bit flatter. And then once I can find some of those adhesions where that may be restricting some of his range of motion, I may go in with a little bit of a sharper tool and kind of try to break up some of that either excessive scar tissue or muscle adhesions that may be limiting that range of motion. So the patient's just going to look straight forward. I'm just going to apply just light lotion on there. And I'm going to start up in the occiput and then work my way down into the insertions. So first thing I'm going to do is just start with my scanner tool. So just applying some light pressure. You can see he's starting to get a little bit red, not pushing too hard. So again, I'm using the scanner tool to see if I can find any adhesions within the upper trapezius. If there are any larger adhesions, typically they'll show up as like a darker red than the rest of the skin. So I don't know if you can see in the video, but I can see there's one adhesion here. So I'm going to take my sharper tool and then just apply some light pressure here. Pressure okay? Remember back to the video presentation when you are applying this type of treatment and you start to see some of the petechiae, so that's those small red bumps right in here. You can kind of see here he's starting to get a couple. That just means that you need to kind of move away from the area just because that's breaking up some smaller blood vessels, and you just want to make sure that you aren't causing too much damage where they will bruise afterwards. So now I'm just taking the sharper tool and moving down into the insertion. Good. I like to take the scanner tool and start back up in the occiput, just relieving any tension in the back of the head that could be causing some of that, some of those tension headaches that can basically caused from a tight trapezius pulling on the back of the occiput and then causing those radiating symptoms to the anterior skull. All right, so now that we're done with the upper trapezius, I'm going to go into the middle and the lower trap. So remember, the middle trap goes from about C7 to T5, and then the lower trap goes down from T6 to T12. Again, starting out with my scanner tool, I'm just going to start along the thoracic spine and then move laterally. Pressure okay?
Yes.
And then I'm going to take a little bit of a sharper tool and then just try to carve out some of those adhesions. So remember, within the thoracic spine, you can look at the patient's range of motion in rotation. So if they're limited in any way, either turning to the right or the left, that may indicate which side you would need to apply this treatment to. I like to start out with these tools if a patient hasn't had this type of treatment before, just because it's a little bit lighter than the Greston technique tools. And then lastly, I'm just going to go into the lower trapezius. So again, T6 to T12, and then just working laterally from there. If you aren't sure where T12 is, one of the clinical landmarks I like to think about is the end of the 12th rib. It's directly in line with the 12th thoracic vertebrae. And then last thing to think about is that, remember, the trapezius kind of looks like a butterfly. So it comes out to the acromion process and then up into the medial border of the scapula. Now I'm just taking a sharper tool and getting some of those deeper adhesions. Depending on how big the treatment area is, I typically spend between 5 to 8 minutes on soft tissue mobilization. However, if it's a larger area, that would probably take up between 10 to 12 minutes or so. But that's definitely dependent on what your clinical preceptor prefers too. All right, and that is the Gua Sha treatment.